So hi everybody, so today I'm joined with Matt Timmins, who is our expert patient and has very kindly offered to come and tell us a little bit about his experience. We've already filmed a video with Dr. Pat McCanthan, who has, we've covered a lot about your journey, haven't we, Matt?
Sure.
But very usefully, Matt has provided us with a number of questions that is from your community, is that right?
It's from a support group I'm with. There's 8,000 people on there that have got Stoma. So
exactly.
So let's ask those guys and see what they think.
Yes, exactly, and that's great. So we've got a bunch of questions that are coming in from lots of people who have questions, and we just thought we'd go through a couple of them and you can share your experience. Okay, so starting from the top, a question about returning to work, and Matt has already emphasised how important this is. Obviously it's a huge topic in itself, but what do I need to tell my employer regarding this condition, and will I even be able to return to work?
Okay, so for a start, there's no immediate pressure to tell your employer everything. From my personal experience, it's advantageous because any support and help you need, you will be provided with. Now, in the UK, we have something called the Equality Act. So that's in place to reduce any disadvantages. Anyone with an ongoing condition that may be classed as a disability can have put in place. Now, because a stoma is permanent until it's reversed, you would class it as a permanent fistula. So you can have things put in place to help you. So things, for example, you can have put in place. You can have a toilet that's a bit bigger. Okay. Yeah. You can have a mirror put in, some shelving put in, some storage to store your stoma bags, your wipes, all your sanitary stuff there that's important. Maybe you change your clothes.
Sure.
Anything to make your kind of day-to-day work life a little bit easier. You might find you're allowed to have a staff member when perhaps not everyone else can have a staff member. But it's certainly important to approach your employer if these are things that would help you. Don't feel you're being a nuisance. All you're actually doing is trying to support yourself in your work as best you can. And your employer wants you to do that anyway, because in general they don't want you to phone in sick. They want you to be well and feel happy in the workplace.
Absolutely. So there's an incentive for that. And I guess just in your experience, for somebody who might be a bit apprehensive about having this conversation, do you have any tips or suggestions of the kind of things that they can start the conversation off with, or how may you approach?
Yeah, I mean, I would, if you've had surgery, I'd be thinking you've probably had some form of discussion previously with your employer. It may be a case you need to have occupational health conversation. Don't be terrified of that. Again, they're there to make sure you've got everything you need in place to do the job that you actually paid to do. So those kind of conversations, they may ask you certain questions. Don't be phased too much, just answer as truthfully as you can. But bear in mind, if you need support, you need to tell them.
Yes.
They're not going to predict that. If you struggle with movement for now, maybe you need a bit of extra support. So don't be afraid to ask.
Lovely, wonderful. And I guess the second part of that was, will I even be able to return to work? So how do you go about navigating that?
So for most people, yes.
Okay.
For most people, yes. There will be a certain percentage who develop such severe complications whereby they can't work. We're obviously quite empathetic to anyone like that, and it's always kind of a thought process in your mind. You're thinking, will I be okay to go back to work? Don't be too hard on yourself in that process. Just give yourself a bit of time. I can't answer definitively yes you'll be able to go back, no you won't. In the majority of cases, people can go back to work, and you usually find in general their work life quality is a lot better versus before. For me, I was running to the toilet every 5 minutes.
Yes, and we're talking here like after you've had surgery, is that right? So how to have this conversation following surgery.
So after surgery, I found it a lot better. I just didn't have that pressure to be like, oh my gosh, I've got to keep running to the toilet. But I didn't have that, so it was really good. And with the stoma as well, not everyone is having one because of IBD. It can be through many different factors. We even experienced like people that have had childbirth and then cancers and certain various conditions that may lead to that. So we have to respect that. Not everyone's got the IBD journey.
Yeah, so. No, absolutely. Okay, thank you for that. So the next question, and I'm guessing this is also a big one, is does it get better?
I have to say, I think it does. I think it really does get better. What I will say is, it's a bit of a roller coaster.
Yeah.
I'm adamantly against before and after photographs usually, because they don't tell the true story. The true story is you've got a life-long condition, or maybe you've had a cancer or whatever it may be, and that has affected your body.
Yeah.
So it's unrealistic to go, hey, here's me today, here's me tomorrow, now I'm absolutely wonderful, I've never had a problem ever again. So what we have to expect is, okay, it's a bit different, it's a bit harder, but we're going to try and get used to that each day. And you can, I think people in general can improve their life quality with this.
Lovely. And I've sometimes heard the term like new normal. Is that something you resonate
That's with? A good one, yeah, you could do that, you could look at it that way. There's various, I suppose, phrases, you can look at it with, but yeah, that's a good one, sure.
Lovely. Okay, and then the next question is, will everybody realise that you have a stoma when you're out and about? And the person asking this question has expressed some worry that the bag will be obvious to others.
Well, it depends what beach you go on. No. Okay.
True.
So, for the majority, if you're closed at the time, probably not.
Yeah.
Some things that you will actually find, certain bags, I found actually lighter bags can be seen through the clothing a bit more actually. So just experiment with it. I mean, if it's, for some people they actually couldn't care less at all. I've been on holidays where I've seen people I don't even know and they've got a stoma bag and they're sunbathing.
Yeah.
And I've done it myself. Not that you can tell, of course. But so it's an individual one that some people will be like, oh, but straight question, can you immediately tell no?
Yes.
You can't. And the other thing you can do, if you're conscious about that, is wear certain things that cover this up. For example, there's certain types of underwear.
Okay.
You can actually buy vests that hold you in place as well. The only thing I'll say is if it's a strong type of support wear, be mindful, you probably don't want to wear it for too many hours. Because if you can imagine it as like almost holding your breath, you don't want to be like encased in for too long. Or if you're having a big meal, you know what I mean?
You want to have that. You don't want that.
So to be kind to yourself in that moment. Don't just think, I've got to, no one can ever see this, no one can ever look at it. Because it's part of your body now.
Sure.
And that's not anything to be ashamed of.
Yes. That's very poignant, I think, to bear in mind, although easier said than done. So the next question is, do you have to stay with the suppliers you started with, and how do you contact stoma nurses if you have any problems?
Okay, so I'll answer the first one first. The answer is no, you don't have to stay with the suppliers you go with. Here's what I'll say to be mindful of. Don't instantly switch because you're having a bad experience. Okay? Because it's very, very tempting to go, I didn't have my bags delivered on time this month.
Right.
Forget you, I'm going to go to the next one.
Sure. Yeah.
And that can create some problems sometimes. And the reason being, certain companies can be affiliated with certain, kind of other parts and stuff. But what you don't want to do is make a snap decision and regret it.
Okay.
So if in general your supply company is good, stick with them. There's another debate here as well, because you've got the supply company, that's the company that's delivering.
Yes, yeah.
And then you've got the products you're using, which could be a multitude of companies.
Sure, yeah.
So you might have one brand for your bag, another brand for a seal you might need. You might have another brand for an adhesive remover you're using.
Yeah.
So you might be on three different. So you've got to remember all this, and on the other end of that is your doctor, or the supply company, either one, because the doctor will still have to approve your prescription. So I'd just say don't make a snap decision on that. Yeah. There was a second part to that question.
So the second part, I think it was the same person asking 2 questions. The second one was, how do you get in touch with your stoma nurses if there are any problems?
Okay, so when you're discharged from hospital, as far as I'm aware, you should be given some information with certainly an email address and certainly a contact number.
Yes.
Try and keep these in your phone.
Yeah.
Piece of paper's no good. Okay. Sure. Put them in your smartphone. Let it be smart. Okay. Yeah, take all the work out of it. You know, and then you can just go from there. Really. Again, these are busy people. You know, I mean, I was just talking there saying there's an online group there with 8,000 people. You can imagine. There's not this many stoma nurses to deal with this type of demand. But again, we don't all approach the stoma nurses every day.
Sure.
Personally, I'll only go to them if there's a problem. And another little factor there, if you are a complicated patient, so for example, maybe you've got a hernia, maybe you've got a couple of other things going on, they may refer you up to your surgeon.
I see, okay.
So it's very good actually to have when you phone up, just say to them what symptoms you're having.
I see.
And you might find they refer to your surgeon in that case.
Sure. So it's just finding the right person who
can
help with whatever issue. Okay, lovely. So the next question is about the post-operative diet and exercise limitations. So this person has said that too many people are frightened to even move and they are too scared to have a normal diet. And there's quite a lot of confusion around this. So in your experience, what can you say about a post-operative diet and exercise?
I'll be honest, I haven't figured it out. I tried so much to figure out. So, I mean, I get dehydration a lot. I'm not going to make this too much about myself here. In general, post-operatively, you need to have reduced fibre.
Sure.
Now, I know a lot of people are going to say, this is a load of nonsense. But what it is, you have to allow the remaining bowel, that is, and your small intestine, time to heal from the surgery before we start overworking it. So the reason fiber's got such a great reputation is because of the work it makes the bowel do. In this case, you don't want the bowel to do a lot of work.
Yes.
You want it to do a bit of less. Okay. So you're now into a balanced situation, 4 to 6 weeks. You can eat normally. Yeah. Okay. What I would say is, in terms of that, keep it low fibre to start with. Yeah. Right. If you're going to add new foods, add them in one at a time.
Sure.
Okay? Because what people tend to do, they go, I've got to be healthy, here's what I'm going to do. I'm going to have some lettuce, some cucumbers, some tomatoes, some onions, and you have no idea what's caused the problem.
Sure.
Keep your fluid up.
Yeah.
Is always a good one. For people who've got stoma, we need extra electrolytes.
Yes.
And that's because you haven't got your large bowel anymore, so you can't absorb fluid as well.
Yeah.
So that was exercise, wasn't it?
Correct.
Okay. So exercise, focus on small amounts of movement. Okay. If you can reduce the amount of time you lie down, try and move that to a sitting position. From a sitting position, try standing, try walking. Again, it's going to be beneficial if you can do anything in terms of something like clinical Pilates, that type of thing, where you're embracing using your core again. When I say using your core, I don't mean doing hanging leg raises and 400 crunches. Something that's going to pull that all together, just to support you really well. Because you've got to think of your trunk now as this is the line which is going to help my movement.
Yes.
And if that's nice and strong, it's great, because then you can add in the so-called regular exercises where we're going running or whatever else it is you enjoy doing. It might be swimming for someone, it could be anything, you know. So,
lovely. There's a question I had actually, not from here, just relating to the diet. I know sometimes like in the recovery process, some people can have these like supplemental drinks, nutritional drinks. Is that something you would continue or not?
I'm not a medical expert. Personally, I wouldn't advise against them. We're locked out here, by the way, guys. There you go.
Thank you.
But yeah, personally, I wouldn't always recommend them. For if your doctor's saying to you, have this, then that's a conversation maybe to have with your doctor and maybe listen to the doctor at that point. I just don't think they're great. After surgery in particular, unless you can't have real, food as such, I would always go to food first.
Sure.
Just because you kind of it's easier in my view to stick with, you know what I mean. But if I also respect so many patients that they don't have that choice. So for some they even have TPN and things like that. So it's you know, my heart goes out to these patients because it's not easy. You know.
No, of course. Thank you, Matt. So the next question, this is from somebody who's asked, is there anything I can do before surgery to help my recovery? And then they've gone on to kind of elaborate and said that I wasn't told anything about strengthening my core from stoma nurses or the consultant prior to the operation, and not sure how much it can help, but it does make you feel more in control when you're waiting for the date. So yeah, I think you touched on that a little bit, but so this is more pre-operatively, what kind of things can you do?
Pre-operatively, I would actually suggest improving your cardiovascular fitness.
Okay, so more than your core muscles.
Yeah, I mean, the thing to remember is you're going to be operated on.
Yeah.
Okay, so you're going to have to recover from that anyway. Would I suggest doing loads and loads of ab work before that? Maybe not. Maybe work on your breathing. Yeah. Okay, work on your breathing, work on the movement of your legs in particular, because your legs and your back, heavy muscles, so you need to kind of remember that. So things like, even if you can do like a bodyweight squat, bodyweight squats are fantastic, because you haven't had the surgery yet, so you haven't got, you're not healing, so you can do that little bit of tension in your abdomen and stuff as you're doing it, you know. Remember to breathe out at the correct points, because what it is, you don't want to create too much intra-abdominal pressure.
Of course, yeah.
That's important, especially for healing as well. So that's important pre and it's important post.
Sure, of course, thank you. The next question is, I would ask if there was a support group near me that I could get to. These are comments that people have said. So what are your thoughts on joining support groups, and where can people find these?
The internet.
Yeah.
Okay, short, simple. I mean, you can actually speak to your consultants as well. You can speak to your consultant, say, oh look, is there any local, to me, support groups for people who've got conditions that I've got, conditions like, for example, the stoma groups and stuff like that. But just have a Google. There's loads on there, and you might find one. You might join a group and think, it's not for me.
Yeah.
That's perfectly okay.
Yeah.
For some people, they're really, they want to have that.
Yes.
And for other people, they don't want nothing to do with that at all.
Yeah.
They want to be like, I don't need you. I don't want to listen to Matt going on again. But you know what I mean? So it's like, each person to their own,
Of course. And we were having this conversation before filming that you were saying that there's a large community now. So as you said, just because you may not find like your group of people in one, it doesn't mean that there's not something else out there for you. So,
yeah, absolutely.
So the next question is, I was expecting to empty my bag 6 to 8 times a day and through the night. Almost 3 weeks after the operation, I've not had to empty the bag through the night yet, and I've emptied it 4 times a day maximum, and they've said everybody is so different. So can you talk to us a little bit about like the expectations and people knowing that different things are normal?
Firstly, this person is a genius. Whoever they are, I need their contact numbers.
What are they doing?
That's amazing. Congrats to them. But I mean, in general, you will have to wake up usually for an empty. Yeah. So don't worry about setting an alarm clock anymore.
Yeah.
Okay, you got one.
You will wake up.
It's there, and it's a real world connection. You will wake up in time. 9 times out of 10. There's going to be people watching this now going, this is your fault. Okay, I'm going to change my sheets now because this is you. You did this. Okay, hands up. But you will get used to it. Yeah. What can you do? There are certain things you can do to get into a pattern. By the way, I'm not great at this at all, but I know people that do it. Yeah. So what they do is sometimes they have a set time they stop eating. So for some people it's like, right, okay, from 8 o'clock I'm not going to eat anymore. Sure. For some people it's even earlier than that. Yeah. I like food too much for that. So I'm not one to, I'll take the getting up in the night or whatever. But one thing I will say is, if you are reaching a stage where you're having to empty your bag and it goes into like double figures, or you find there's a lot of output, speak to your guide, speak to your stoma nurses, because that can be what you call a high output stoma. And with having a stoma, you can become at risk of having what you call an AKI, which is an acute kidney injury, due to dehydration. And this is one of the things that present risk is when you're emptying your bag all the time. So what you've got to remember is each time you're emptying your bag, you're losing fluid, you're losing your electrolytes. So it's important to just keep that in mind. And again, it's important to have a good supply of electrolytes. You can speak to your doctor about this as well. Should be providing you with some form of electrolyte, usually, as long as they can tolerate certain things. But yeah, that's pretty much for that.
Lovely. And I think this is more again like a comment where you're very welcome to elaborate on it. It says, don't be afraid to ask for help. If your stoma is uncomfortable, leaking, sore, or anything, always ask for advice, as that's what the stoma nurses are there for. So don't tough it out and suffer.
Absolutely not. And I think there is a big thing here where patients in general, I've done it myself, you think to yourself, I shouldn't be going to A&E. I shouldn't be going. I'm wasting their time. Please try not to have that thought process, because we'd rather you ring 111 or we'd rather you get checked out somehow and have peace of mind than develop a complication or whatever. You know, as I say, I'm not medically trained, but I can say for certain, there are certain times you will know, as a person managing your own condition, you'll be like, something's wrong. Those are the moments you go, I'm going to get checked. And that's the sound advice for anyone really, any condition.
Fabulous. And Matt, I think that's all of the questions.
Okay.
Is there anything else that you would like to share, just that isn't on there, that you feel is important to be out there?
I'd actually say, just try and develop a bit of a structured routine. Because having surgery can throw things, or you're used to doing things and now you can't do this, or this is different, or whatever it is. Try and develop a little bit of a routine for yourself. So whether that's, like I say, you have a routine before you go to bed where you wind down, you maybe put down your, whatever you're having, and you can see, okay, I'm going to try and not go to the little whatever, maybe I'll get a whole night's sleep once, or maybe I only have to wake up once. Try certain foods, but you're not going to know until you try them. Again, I know there'll be a percentage of people watching going, I have this specific dietary problem. We're not individualising here, so everyone, we respect everyone's journey. But let's say in general, don't be afraid to try things, because that's important.
And that's how everybody finds whatever that's unique to them. And I did have one other question, sorry, that we did ask before. You said that you've got little ones at home. The question of how do you explain to your little ones that I have a stoma and this is how I use the toilet now? What advice would you give to parents?
If you can get one of those, it's like a pretend stoma you stick on your tummy. They're good. Actually, let me just say, there's another thing you can get, especially for small kids. It's a great thing. There's something called Buttony Bear.
Okay.
And it's a bear that's got a stoma bag.
Lovely.
And this bear is so famous now, and I think he deserves a mention here. Because there's so many people, especially young children in hospital, and thinking there's no one like me. And that bear is just so comforting for them. And I think it's a really important thing that they actually go, oh, okay. So you can go on, I'm not sure on the exact thing, but if you type in Buttony Bear, I'm sure there'll be something there you can link to.
Okay, lovely. Right. Thank you so much, Matt. All right,
okay, thanks again. Cheers.